You've probably heard this one. After 30, you lose 3 to 8% of your muscle every single year. If that were true, most people in their 40s would be falling apart. They're not. Here's the honest version. Muscle loss with age is real, but a lot of the internet is quoting the wrong unit. Reviews usually talk about roughly 3 to 8% per decade, not per year. And the part that actually wrecks daily life? That's often strength fading faster than the scale of muscle mass suggests. So, what really happens after 40? And what actually helps? Stick with me. Hey, welcome to Evidence Health USA, where we trade health panic for what the research actually says. Today, the overhyped muscle loss statistic, the difference between losing size and losing strength, what sarcopenia means when clinicians use that word, and the two levers with the best human evidence: progressive resistance training and enough protein. Quick disclaimer up front: this is education, not a diagnosis, and not personalized medical advice. If you've had unexplained weight loss, frequent falls, new weakness, or you have a medical condition, especially kidney disease, talk with a clinician before big diet or training changes. Okay, let's kill the scary headline first. You'll see posts that say muscle disappears at 3 to 8% a year after 30. That framing shows up everywhere because it sounds urgent. It also happens to be, roughly 10 times worse than the rate many scientific reviews actually cite. Across aging research, a common line is that muscle mass declines about 3 to 8% per decade after the early 30s, with the slope often getting steeper later in life. That's still meaningful. It's just not your arms dissolve before your kids graduate. A big quantitative review by Mitchell and colleagues in 2012 put numbers on this carefully. When they looked across studies comparing younger adults with older adults, the median mass loss rate was about 0.47% per year in men and 0.37% per year in women. That's roughly 4 to 5% per decade, in the same ballpark as that 3 to 8% per decade line. And when researchers follow people around age 75 over time, muscle mass may fall closer to about 0.6 to 1% per year. Still serious, still not the viral 3 to 8% every year starting at 30. So if you're 40 and terrified you already lost a third of your muscle, breathe. The fear is usually inflated. The problem is still worth respecting. Here's the twist a lot of thumbnails skip: muscle size and muscle strength do not decline on the same schedule. That same Mitchell review notes that in older adults, strength can drop on the order of about 2.5 to 4% per year, and in studies that measured both, strength often fell 2 to 5 times faster than mass. Researchers even use a separate word for strength loss: dynapenia. That's why you can look fine in a mirror and still struggle with a suitcase, a jar lid, or getting up from a low couch. The functional cliff is frequently strength and power, not just how your genes fit. Sarcopenia is the clinical name people throw around for age-related muscle failure. In 2019, the European Working Group on Sarcopenia in Older People, EWGSOP2, updated the definition. They put low muscle strength first. Probable sarcopenia starts with weak strength. A confirmed diagnosis also needs low muscle quantity or quality. If physical performance is also low, they call it severe. That matters for two reasons. 1. You're not sarcopenic just because you skipped the gym for a month after a vacation. 2. The experts themselves admit these changes can start earlier in life, but the condition is much more common in older age. Midlife is when many people first notice the slope. Later life is when the diagnosis becomes far more common. Internet posts love a nightmare percentage. Real reviews give a range. A 2014 systematic review from the International Sarcopenia Initiative found community prevalence between about 1 and 29%, depending on age, region, and methods, and higher rates in long-term care. Later work using the newer EWGSOP2 criteria often finds lower rates than the older definition. So no, it is not honest to say half of people over 40 have sarcopenia. What is honest? Low strength and low muscle reserve become more common with age, illness, and inactivity, and they matter for falls, independence, and recovery from stress. Association, not a crystal ball. Having less muscle or strength is linked with worse outcomes in many studies. That does not mean every 40-year-old is doomed. Even if the viral yearly rate is overstated, your 40s are not a free pass. More sitting, harder recovery, under-eating protein while dieting, illness, injury, and long gaps from training all accelerate loss. Some of what people blame on turning 40 is really underloading the muscle for months or years. That's good news. Part of the slope is modifiable. If you remember one practical thing from this video, make it this. The U.S. Physical Activity Guidelines, HHS, echoed by the CDC, say adults should do muscle strengthening activities of moderate or greater intensity, working all major muscle groups on 2 or more days a week. Not endless cardio alone. Actual resistance. The National Institute on Aging puts it in plain language too. Strength training helps maintain muscle, supports everyday function, and it's never somehow too late to start building a stronger baseline. And when researchers look specifically at people with sarcopenia, supervised resistance exercise is the intervention with the clearest signal for strength and physical performance. A major systematic review from that International Sarcopenia Initiative called the exercise evidence moderate quality and still recommended supervised resistance work. What does that look like in real life? 2 or 3 sessions a week. Legs, hips, back, chest, shoulders, arms, core. Hard enough that the last reps are challenging. Machines, free weights, bands, or well-coached bodyweight work all count if you progress them. If you're new, injured, or managing blood pressure, joint disease, or balance issues, get a professional plan. Pushing through pain is not a protocol. Protein is the second lever. Important and wildly oversold as a solo fix. Older adults often need more protein than the old 0.8 grams per kilogram RDA story implies. Not because protein is magic, but because aging muscle can be a little harder to stimulate. The Prot-Age expert group recommended about 1.0 to 1.2 grams of protein per kilogram per day for healthy older adults, and often at least 1.2 if they're exercising, with higher needs and illness, and a clear caution for severe kidney disease. If you're in your 40s or 50s, you're not automatically in that exact older adult bracket, but under-eating protein while lifting, or while dieting hard, is still a common own goal. When healthy adults add protein on top of resistance training, a big meta-analysis by Morton and colleagues, 49 trials, almost 1,900 people, found extra gains in strength and fat-free mass. The average fat-free mass bump was modest, about 1/3 of a kilogram more than training alone. Benefits for lean mass got smaller with older age, and past roughly 1.6 grams per kilogram per day, they didn't see more fat-free mass benefit. So powder is optional. Hitting your daily protein from food, chicken, fish, eggs, dairy, tofu, beans, Greek yogurt, is the actual job. Spreading it across meals helps a lot of people hit the total without a giant dinner scramble. What does not hold up well? Swallowing protein shakes while staying sedentary and expecting sarcopenia to reverse. Reviews of nutrition-only approaches are mixed. Exercise is still the backbone. Here's a boring plan that beats any brutal reality thumbnail. 2 full-body strength sessions, squat or leg press, a hinge, a push, a pull, and some core work. Add a 3rd day if you recover well. Walk most days. Cardio still matters. It just isn't a substitute for loading muscle. Spread protein across meals. Treat powder as optional convenience, not a personality. Give it months, not days. If stairs suddenly feel scary, you're losing weight without trying, or you're falling, talk with a clinician and often a physical therapist. Aging does not stop if you lift. Not every person over 40 has sarcopenia. Protein powder is not a medical treatment. What holds up? The viral yearly disappearance rate is usually overstated. Strength deserves more attention than the mirror, and progressive resistance training, plus adequate protein, is the best supported lifestyle combo for protecting function. 1. The widely shared 3 to 8% muscle loss per year after 30 line is typically a misquote of decade-scale rates. Think slower than the panic posts, still real, especially later in life. 2. Strength often declines faster than muscle mass, and modern sarcopenia definitions put strength first for a reason. 3. Aim for muscle strengthening at least twice a week, eat enough protein to support that training, and get medical help for sudden or severe changes. That's the hopeful part. A lot of what midlife adults fear is partly under their influence. If this calmed the panic and gave you a clearer plan, subscribe to Evidence Health USA. We do evidence without the scare tactics. Comment what you want next: protein timing, walking versus lifting for longevity, or how menopause changes the muscle story. And if you only change one thing this week, make it a real strength session. Thanks for watching.